the program the data hasn't fully been analyzed yet, but of the 53 participants that have finished the program, we have so far found significant improvements in upper body strength, lower body strength, and overall improvements in aerobic capacity. On the psychological side, we found significant improvements in overall tiredness, depression, and drowsiness. Now I'll note that tiredness and drowsiness are highly related to fatigue, which is again the highest reported side effect. We also found significant improvements in overall patient-reported well-being, so they reported feeling better. Also with the well-being checkups, we gave it to them on the 1st, 3rd, 6th, 9th, and 12th weeks before and after class. So we began to see was it improvements from before class to after class and many of the psychological variables. So in other words, they left the class feeling better than they came, even on a short-term basis. So we know the benefits widely in the research is both safe and beneficial to exercise for cancer survivors. However, the problem is survivors aren't doing it. A recent study estimated that only 22% of cancer survivors meet recommended levels of physical activity. And for those studies who have showed a follow-up study, either 6 months, 12 months, or longer, have shown that the results aren't that much better for those even who have been in a specific exercise program. So despite this growing body of knowledge, survivors are still remaining largely sedentary. So out of that knowledge, we developed the enhanced program maintenance phase, which was a follow-up study and follow-up program for those participants of the enhanced program. We looked at quality of life for that continue after the program, exercise adherence, and we wanted to look at barriers to exercise. So for those who weren't engaged in exercise, why they weren't. So recruitment for this program is actually out of the enhanced program itself. So when the participants finished their 12 weeks, they were given the choice to join the program or not. The program itself had 3 options. They could either come to a free fitness facility that we provided for them with volunteers who would work with them, give them their own kind of things to do. They could also come to a specific time that was dedicated to them, so a head, neck time, and a brain time that was with the enhanced program staff, where they would progress exercise, give them tips, tools, and work alongside them with their exercise programs. We also had exercise classes run by the enhanced staff, one for head, neck, one for brain, actual exercise classes that they could attend. There's a specific focus in the maintenance phase that wanted to equip the survivors, not just give them an exercise class, but equip them to engage in further behavior. We use strategies such as goal setting to teach good behaviors. So they could set goals for long term, things like I want to gain 10 pounds of muscle, I want to improve my squats by 2 reps, or short term as I want to come in on Friday, I want to exercise next week, Monday and Friday. Just small tools they could use to improve their behavior outside of the actual program itself. So the assessments we used for the maintenance phase was again the personal well-being checklist, the same one. We also used the FACT BR and the FACT H and N. The FACT questionnaires are a general quality of life questionnaire that was designed for cancer survivors. The first couple pages are general among cancer survivors, and the last pages are specific to the population. So H and N for the head and neck, and the BR for brain. Examples would be for head and neck. On the last page it talks about ability to swallow, eating the same kind of foods as before, all those kind of things. We also looked at a barrier questionnaire, so what the barriers people felt were and how badly they felt that was affecting their exercise. And we used the same logs again, so we wanted to see the frequency of exercise, the intensity, and the type of time that they were doing, so we can hopefully correlate how much they were doing to the benefits they were gaining. Now the results for this program haven't been analyzed yet either. So we don't quite know what's going to happen yet, but we're hoping to see improved adherence as a result of the program that we're providing, as well as trying to correlate what if cancer survivors aren't being active, why they aren't being active. So Dr. Kulis Reed, who's the director of the Health and Wellness Lab, is interested in not just contributing to the growing body of knowledge, but translating that knowledge into sustainable community programs for cancer survivors, those who need it. Because we know that exercise is beneficial, but it's still not a large part of cancer survivors' lives. So with that in mind, we started many community-based programs that target cancer survivors specifically. Our hope is that we can move them through exercise from just surviving to thriving and improving their quality of life. So we offer 3 programs in the Thrive program: Yoga Thrive, the Thrive Lab, and the Thrive Center. Yoga Thrive is a yoga program for cancer survivors. The Thrive Lab is individualized testing and prescription. And the Thrive Center is an open gym that's available for all cancer survivors and their support people. So Yoga Thrive, it's a 12-week hatha yoga program. Hatha yoga is a very simple, slow type of yoga. It's research-based, which means it's heavily influenced by our research. Yoga Thrive actually started out of our research. We had a yoga study, and based on the participant demand that they wanted to go through the study again, we actually opened up to a community program. And so it's now runs out of various studios throughout the city of Calgary, as well as rural Alberta, and we've now moved slowly into Eastern Canada as well. So all of our instructors undergo specific training to work with complicated contraindications and the special needs of the survivors that they deal with. And so for all cancer survivors and their support people, so they can bring a friend, bring their daughter, bring their mother, anyone who helps them to keep active and will support them in that. We have 2 levels of Yoga Thrive. There's level 1 and level 2. So once you progress from level 1, you can move on to level 2 and you get more of the tougher yoga and more benefit for you. We also have a DVD. The DVD is produced for those who live in rural communities who can't access the actual classes, and for those who finish the program and want to continue it at home on their own. The Thrive Lab provides individually tailored exercise programs and testing. We offer 2 programs, the Cardio Thrive and the Functional Thrive. Cardio Thrive is based on cardiovascular training. So the testing is done with lactate threshold, which has been shown to be a better indicator for aerobic capacity for cancer survivors. And then the Functional Thrive, which is strength and flexibility-based program. We employ certified exercise specialists, certified exercise physiologists who have special training to work again with the contraindications and special needs of the population. So how the program itself works, the participant will come in, they'll receive their fitness test, and they'll come in again and they'll go over the results with the CEP, and they'll be prescribed their exercise program, and they'll be taught how to do the program properly and safely. They'll then be free to take the program either to the Thrive Center, which is a free gym, or take it back to their home, or whatever gym they feel most comfortable in. And finally, the Thrive Center. So the Thrive Center is a free exercise facility for all cancer survivors, and again, their support people. It's located on the campus of the University of Calgary, and is entirely volunteer run. So we have kinesiology volunteers, both undergraduates and postgraduates, who have undergone a specific training from us, who work with the cancer survivors. So the training itself involves knowledge on what cancer itself is, how that affects people, and how to work with individuals on a practical level. So practical tools and tips for working in an exercise setting with a clinical population. It's currently open 6 days a week. The Thrive Center, we call it a safe and supportive environment, and that's for 2 reasons. Firstly, it's safe in that we have strict sanitization procedures. Many of our participants who are on treatment are immune suppressed, and so having a sanitized place is very important to them, especially as we're beginning a study with pediatric oncology, with hemolytic stem cell transplant, and so these children are very susceptible. And it's also safe because it's only open for cancer survivors. What that means is you don't have the marathon runner and the bodybuilder working right next to you. So it's a place you can come, take off your wig, you can wear a bandana, we have lots of lymphedema sleeves, and it's okay to work at your own pace. You don't have to feel threatened by those else around you. So the take-home message for me is exercise has been proven to be safe and beneficial to all cancer survivors at any point in the spectrum. It doesn't seem to matter what you do, as long as you do something. Generally, some is better than none, but more is better than some. However, the only way to maintain the benefits is to continue to exercise adherence. So at the Coolidge Health and Wellness Lab, we hope that through our community-based sustainable programming, we can help survivors move from surviving to thriving through the use of exercise.
Thank you, Kevin. Are there questions for